Hi, you're listening to Talk 1260 KTRC. This is Dr. Daniel Ronel on Western Medicine, talking with my wife, Betsy Ronel. We're going to talk now. We're going to talk now about mommy makeovers.
Right.
A big topic. So
big deal.
Yes. What are your thoughts on that?
My thoughts, with a snort, are that they are so popular now because I think women have dealt for so many decades just tolerating the results after childbirth.
Right.
The saggy skin, saggy muscles, saggy bosoms, boobs, fat thighs, fat behind.
Right.
Maybe I just think your whole skin texture changes. So I think we've just tolerated it, not realizing there were alternatives for the everyday person.
Yeah, what a lot of the women are saying when they come to see me is they don't really want a new body. They want to just go back to what they were before they got pregnant. And typically the areas are breast and abdomen.
And the upper thighs, I think.
Yeah, actually it could be anything.
Right.
I mean, it could be whatever you want to restore to get back to where you were before. And what the reason it's called a mommy makeover is because it's a combination of procedures. Whereas,
like what?
10 years ago, people would do an abdominoplasty, a tummy tuck.
What's the most popular combination you get?
It's breast and abdomen. It's a breast augmentation.
Which is what?
Which is putting implants into breasts.
Is there a lift involved?
Sometimes, depends on where the nipple is.
Okay.
And
where's the wrong place for the nipple?
If the nipple is below
this
the
is
fold,
not a sexual question.
Yeah, okay, so you look at the fold that's under the breast, it's called the inframammary fold, and if the nipple is below the fold, it needs to be lifted.
So if you can catch a pencil under your boob and the nipple's pointing below the pencil,
that's
time for a
lift.
lift.
Yeah,
okay. That's the average woman's test, I'll tell you that right now.
I think that's a great test. And because if you put an implant in and you don't do that, it looks like a rock and a sock. It just doesn't look very nice. So the most popular combination is to rejuvenate the breasts with an implant, with or without a lift, and to do a tummy tuck at the same time.
I had a lift.
All right.
I did a tummy tuck. And then what's the second most popular? Where does lipo come into any of
Right,
this?
that's for people who don't really need a tummy tuck, then lipo is the other option. Basically, it's breast and abdomen at the same time. And 10, 15 years ago, people were not combining these surgeries because it wasn't really that safe to combine them. Now, with our new techniques in modern medicine, modern anesthesia, it's a lot safer.
Come a long way.
Right.
Yeah, you can do some of these operations in how many hours?
3, 4 hours.
Right. That's very, very safe for anesthesia. You don't want to go over 6, right?
No, it doesn't really matter.
Anesthesia. Okay, that's my opinion. Well, here's my personal story is I have had 2 children, as you well know, in 5 years, right? No. How many children did I have? I don't know math.
You had your first one 6 years ago.
Okay, so there you go.
Okay,
I don't know if that matters. But anyway, okay.
So,
and I was, 32 when the first one was born, and I was 36 when the second one, 35 when the second one was born, I think. And, my skin, I felt young, but my skin clearly did not feel so young. So I lost elasticity in my stomach.
Right.
My stomach muscles spread just a little bit, and my boobs looked like a natural rock in a sock. So it was, a bag of flesh with a little boobie hanging at the bottom. So I got an implant. I vowed I would never get implants, but really after I saw the way my breasts looked, after it took the sucking life out of them, I saw nothing else, because even if you gave me a lift, I still would have been very small, smaller than I was originally. So I got an implant, a lift, and lipo.
You didn't need tummy tucks.
I didn't need a tummy. I wanted one. I would have gotten one. I didn't get one because I'm going to have one more child for sure, we think. And you said that that's not wise to get a tummy tuck if you still think you're going to have another baby.
It depends when you're going to have another baby. If you want to have it relatively soon, like within a year, it doesn't make any sense. But if you're not going to have a baby for 5 years, it doesn't make sense to delay gratification because,
I won't have this next baby before 4 years.
Oh, really?
Yeah.
Okay.
So, it's just up to you. I didn't want to go through, my thought was I will delay gratification because I don't want to go through the torture of, not torture, but the difficulties after surgery of a tummy tuck, then get all stretched out again, possibly need some work again.
I'll tell you.
Does it not happen?
It doesn't really happen that much. With young women who have pregnancy after a tummy tuck, they really don't.
I'll be over 40 when I have my next baby.
No, but physiologically you're very young. And
What does that mean?
It means that your skin is very tight.
Just
You have the
checking.
skin of a 20-year-old,
Just
and
checking.
so having a tummy tuck after having a pregnancy after a tummy tuck actually doesn't cause
Oh,
as big a
really?
deal.
See, I always imagined that it would, which is the reason I put it off. Otherwise, I would have had one. But then, for me, I'm going to have, say I got it, all right? Say I had my tummy tuck already. I have children with C-section because I have to.
Right.
Then they would have gone in and put a C-section scar over that tummy tuck scar. What would that have meant?
Nothing. I could have even been there to open up for them, or they can just,
really?
yeah, they just follow the dotted line. It's very easy for them.
No, I know.
Right.
OBs are excellent. I'm just wondering scar-wise what it would have looked like. Although most OBs do know how now to give it a cosmetic scar.
Right, and they can be fixed by plastic
Also,
surgery.
okay,
anyway
just
after.
checking.
Right,
Just
so-
checking. All right. I mean, you know.
So the point is, with mommy makeovers, there are a lot of options out there. The most common one is breast and tummy.
Oh wait, I also had lipo from my rib cage down to my knee.
Right.
I had that because I got really fat and I could not lose it. I waited 18 months post pregnancy and I still was larger than I wanted to be, and just, you know, I guess my hormones just would. Now I feel better, but my hormones just wouldn't let the fat go.
Right.
So I got the lipo, which
Right.
is great.
Lipo works if your skin is tight and you just have extra fat under your skin. If your skin is loose, there's nothing that lipo can do, because it just makes it worse, actually. But
Oh, really?
Yeah, you didn't have any extra skin,
No,
which
no.
is why you
Right.
got lipo instead.
So general mommy makeovers are what?
In general, mommy makeovers are breast and abdomen. You're listening to Talk 1260 KTRC, Daniel Ronel, Western Medicine. I'm a board-certified plastic surgeon talking with my wife, Betsy. We're talking about mommy makeovers. If you go to our website, you can see plenty of pictures of mommy makeovers, of before and afters. It's www.danielronelmd.com.
You can also email your questions there as well, or comments.
Right. The website is a great website. It's made by Studio X here in Santa Fe. They're excellent.
X for excellent.
Yeah. Okay. Thanks.